If you've already had surgical excision of a tumor and the cancer is still present, then that's the time where you might want to think about having micrographic surgery done. You have to remember that it may not be your previous surgeon or your previous physician's first choice, but if the tumor is still present after they've made their best attempt to try to remove it, it's not because the surgeon or treating physician didn't know what they're doing. They do know what they're doing, but it's likely that they're not able to see the extent of the cancer. Now, micrographic surgery has the great ability of being able to identify tumor extension using its histological analysis method, where we can systematically track the growth of the cancer. This identifies cancers that are or extensions of tumor that are invisible to the naked eye and dramatically helps identifying where residual cancer is present. Now, it is also important to remember that a lot of people don't know when they should consider micrographic surgery. A number of years ago, the American College of Micrographic Surgery identified and created a large review to examine the utility of micrographic surgery in different locations. As you'd imagine, most commonly that's on the head and neck. They created what we call Mohs appropriate use guidelines or appropriate use criteria. And even now, there's an iPad application and an iPhone application where your physician can enter in specific information about your tumor, whether it has an aggressive growth type, whether it's greater or smaller than 2 centimeters or less than 1 centimeter, where on the face or head and neck this location might be, or elsewhere on the body. And through an algorithm, that information is analyzed, and the surgeon or treating physician can get a precise idea as to whether or not micrographic surgery would be a good treatment choice. Again, always remember, as a patient, you're your own best advocate. If a surgical treatment has not worked successfully before or another curative treatment hasn't worked, as you approach an attempt to remove this cancer a second time, sometimes it's better to rethink the approach to treatment and sometimes utilize a technique that has a greater ability to identify the location of that tumor.